They said hospitals save lives. But behind the glass walls of Boston General, I learned that sometimes saving lives comes second to saving reputations. I was a nurse who gave everything for my patients, until the surgeon I trusted most blamed me for his mistake. What I uncovered next exposed a $4.8 million fraud. My name is Emily Carter, and for 12 years, I worked as an ICU nurse at Boston General Hospital, the kind of place where every heartbeat matters and silence means something went wrong. When I first joined, I was 26, idealistic, ambitious, and maybe a little naive. I believed in the system, in the promise that hard work meant respect. And I believed most in Dr. Matthew Langford, the hospital's golden surgeon. He was the kind of doctor every nurse wanted to assist. Calm hands, charming smile, and impossible confidence. He remembered birthdays, bought coffee for night shifts, and always said, "You make this hospital run, Emily." At the time, I didn't know that same voice would one day destroy my reputation, or that the man behind the kind smile was running a secret that could cost lives. It happened on a Tuesday morning, June 12th. A 58-year-old man came into the OR, routine gallbladder removal. Nothing unusual. I was a circulating nurse. Langford was lead surgeon. But halfway through, his movements changed. His hands, usually so precise, trembled. His breathing quickened. I noticed sweat under his mask. When I whispered, "Are you okay, doctor?" he didn't answer. Moments later, he nicked the hepatic artery. A catastrophic mistake. Blood flooded the cavity. The anesthesiologist called for pressure. I clamped. I sucked. I handed sponges faster than I'd ever moved in my life. But the patient coded. The team tried for 20 minutes. Time of death, 10:42 a.m. We stood in stunned silence. Langford's eyes met mine. Not grief, not shock. Fear. That same afternoon, he told the chief of surgery that the patient crashed because the nurse misread the vitals. That nurse was me. By morning, HR had summoned me. There was a formal incident report, typed clinical cold. It stated, "Nurse Emily Carter failed to relay hypotensive readings in a timely manner, resulting in preventable cardiac arrest." I felt my pulse hammer as I read my name on the document. I tried to explain that I'd called out the drop twice, that Langford ignored me, but the director's expression was already decided. They placed me on administrative leave, pending investigation. 12 years of spotless record, gone overnight. Langford didn't call. He didn't text. He didn't even look at me when I passed him in the corridor the day I turned in my badge. But the part that cut deepest was seeing my colleagues, people I'd mentored, avoid eye contact. The whisper spread fast. Emily froze during surgery. My career was over before I could defend myself. For weeks, I stayed home. I replayed every second of that surgery in my mind. Was there something I missed? Something I could have done differently? Then, an old friend from billing, Jared, called me. He sounded uneasy. "Emily, if you didn't hear this from me, but something's off with Langford's reports. He's been coding private procedures as research cases. It's tied to something big. Be careful." Research cases. That meant extra funding, grants, bonuses, government reimbursements. And suddenly, the patient's death made sense. If Langford botched a surgery tied to a federal grant, it wouldn't just be malpractice. It would be fraud. Covering it up meant survival, for him. And I was the perfect scapegoat. 3 nights later, I drove back to Boston General. The security guard at the east entrance had known me for years. "Forgot your tablet?" he smiled, letting me in. I didn't correct him. Inside, the hospital was eerily quiet. The hum of machines, the faint antiseptic smell, all familiar ghosts. In the medical records office, I logged in using my old credentials, praying they hadn't deactivated my access yet. Then I saw it, the file for patient ID 33721. The metadata showed it had been altered 2 hours after the death, by Dr. Langford's personal account. He'd rewritten the vitals, changing timestamps, so it looked like I hadn't called out the drop in blood pressure until it was too late. And in the billing system, he'd listed the surgery under a clinical research code tied to a grant worth $4.8 million. I sat frozen, staring at the screen. Langford hadn't just made a mistake. He was protecting a fraud that ran deeper than one patient. I copied everything: vitals logs, audit trails, billing codes, even the internal memo linking Langford to the research trial. The next morning, I contacted the Massachusetts Medical Board. Then I called the Department of Health and Human Services, Office of Inspector General, the division that investigates healthcare fraud. They told me what I already suspected. If I was right, this wasn't just a malpractice case.
It was a federal crime.
For weeks, I lived in silence. Agents interviewed me. I handed over flash drives, screenshots, timestamps. Every piece of evidence I'd gathered became part of an ongoing investigation, Project Greyline, they called it. And as the investigation grew, I learned the truth. Langford had been submitting falsified surgical data for 3 years, covering up patient injuries to maintain his perfect record and funding. Word must have leaked, because soon, the harassment began. My mailbox is filled with anonymous letters. "You'll regret this." My car tires were slashed outside my apartment. Someone even filed a false prescription order under my nursing license. Langford had connections, powerful ones. But what he didn't realize was that federal investigators were already tracing every digital footprint. Each threat, each falsified form, each altered patient log, it all added to the case. The deeper they dug, the worse it got. They found over $4.8 million in falsified research reimbursements, 2 manipulated death reports, and 3 shell companies funneling consulting fees directly to Langford's account. The man who once told me, "Integrity is everything," was about to lose everything. 6 months later, Boston General's lobby was swarming with reporters. Dr. Matthew Langford, the golden surgeon, was let out in handcuffs. Charges: wire fraud, falsification of medical records, obstruction of justice, and criminal negligence. The hospital's reputation shattered overnight. 2 executives resigned. The research department went under full audit. And my name? Cleared, officially, publicly, irrevocably. I still remember standing outside the courthouse that day, the autumn air crisp, the city noise muffled under the weight of what had just happened. Langford avoided my gaze as the verdict was read. Guilty on all counts. 7 years in federal prison. The same hands that once held scalpels now held prison chains. People ask if I felt relief.
No.
Relief isn't the right word.
It was colder than that. Cleaner.
For months, I'd carried guilt that wasn't mine. Now, seeing his empire crumble, I realized justice doesn't always roar. Sometimes it whispers. The whisper of a printer spitting out evidence. The quiet click of a courtroom door closing behind a liar. The sound of my own name being restored. The Boston General sent me an apology letter. Formal, detached, almost cowardly. They offered reinstatement. I declined. Some things, once broken, don't deserve repair. With the settlement I received as a whistleblower, a small percentage of recovered funds, I started something new. A nonprofit called the Carter Line, a legal aid program for nurses and hospital staff wrongfully accused or silenced by power. In its first year, we helped 11 nurses clear their names. Every one of them had faced what I did: blame without evidence, fear without support. Sometimes they ask how I stayed so calm through it all. I tell them, calm isn't the absence of fear. It's the decision to move through it anyway. Langford's case made national headlines. But my favorite part was a single line buried deep in a court document. Evidence provided by Nurse Emily Carter was instrumental in the prosecution and restitution of funds to federal health care programs. That was enough. A year later, I stood on the rooftop of the new facility my nonprofit funded, sunlight catching the Boston skyline, the city that had once chewed me up and spit me out. In my hand was a single envelope. Inside, a letter from Langford's attorney. Dr. Langford wishes to apologize for his actions. He hopes you find it in your heart to forgive him. I folded it neatly, placed it in a shredder, and watched as the blades turned it to dust. Forgiveness was never the goal. Truth was. And truth had already done its work. Looking back, I realized betrayal isn't always loud. Sometimes, it's a signature on a falsified report. A silence in a meeting. a hand that doesn't reach out when you fall. But revenge, the kind that lasts, isn't fire or fury. It's exposing the lie with precision, patience, and proof. Langford lost everything. I rebuilt mine from the ground up. Boston General will spend years restoring public trust. And every time a nurse speaks up without fear, I know the price I paid was worth it. Because justice doesn't always need forgiveness. Sometimes justice just needs to be finished. If this story moved you, if it reminded you that truth, no matter how small, can take down power, then don't forget to like this video, share it with someone who needs courage, and comment your thoughts below. Your support helps us tell more real stories like this one. And if you haven't yet, subscribe Revenge Uncut and help us reach 5,000 subscribers so we can keep shining light on hidden truths. Because every story, like Emily's, deserves to be heard.